Jericho Road Family Practice sees close to 800 patients a week. 70% of their patients have Medicaid, and 12% have no insurance at all. We spoke with the founder of Jericho Road, Dr. Myron Glick.
Growing up in another country, you have this sense that everyone in the States is rich. You don't have any sense that there's poverty in this country and that there's need. When I was 3 years old, my parents moved to Belize, and they were Mennonite missionaries there. So I lived there from the time I was 3 until 14. My name is Myron Glick. I am 46 years old. I went into medical school very focused on the idea that I was going to become a doctor and then become a missionary doctor somewhere else in the world. In my 3rd and 4th year, when we started to do the clinical rotations, it was made very clear to me that in this country, this richest country in the world, that we have folks that are barely getting by. I remember, say, at a big hospital, you had nurses, you had doctors, you had medical students, and you had patients. But I didn't see anyone was really focusing on taking good care of the patients. People would have to wait 3-4 hours sometimes. My job was to get them something and move on. Because you gotta remember, I grew up as a missionary kid. I'm pretty intense. I'm pretty, focused on caring for folks. And it's jarring to be in a setting where, you get out of the room and the nurses start to joke about the patient. I also was really struck by just a real cynical attitude, this sense that we can't fix this and that maybe these people aren't worth helping. That really was discouraging as a medical student who went into medicine with the idea that we're supposed to serve and help. And so I drafted an ideal clinic. What would I like to do? I didn't really think I could do it all by myself. Residents back then weren't starting practices on their own very often, especially in poor neighborhoods. So the first week we were open every day, and I had this expectation that people would be lining up at the doors to see us, right? But we only saw 3 patients, a mom and her 2 kids. But that was the start of it. And then gradually, people started to come. I know I had it back then, and I still have it, this real sense that being a person of faith is not so much about what happens on Sunday morning in church. It's about what happens through my daily life. It just follows then that should affect the way I practice medicine.